Anna.
I'm Megan. And we have another special guest with us today. It's Emily Lines. How's it going, Emily?
Good. How are you?
Doing splendidly. We're so happy you're here.
Yeah, thank you so much for doing
this. This is super exciting.
Yeah. Emily is my cousin, and more importantly, a nurse at the NICU, at a NICU in a hospital. This is a really cute introduction. You want to tell us what you do?
So I am a NICU nurse. I've been a nurse for 8 years. I currently work at Children's Hospital and Medical Center in Omaha, Nebraska, but I've also worked in 8 other NICUs throughout the U.S., coast to coast, basically.
Amazing. Do you want to tell us what a NICU is?
So it stands for Neonatal Intensive Care Unit.
Awesome.
And it takes care of some of the tiniest babies, but also babies with genetic disorders or metabolic disorders, cardiac issues, diseases, respiratory problems, GI issues. There's a whole gamut of things.
Yeah. Anything that requires intensive care.
Yes. Basically, the freshest babies come to us. They typically have not ever been home when they get to us.
Yeah.
And then they go home from there.
Yeah, what a time.
And time.
We really wanted to talk to you as a part of this podcast experience and our conversation, because it's kind of a rare experience to have a baby in the NICU, and you don't always expect it.
Nope.
It's sometimes a surprise. Sometimes you know ahead of time, but how often I don't know, maybe half the time people don't know ahead of time?
I think it really depends. Mm-hmm. It's kind of a crapshoot. I feel like there are definitely people who find out like a prenatal diagnosis of a cardiac defect, mm-hmm. or they have their intestines outside of their body, or they find out some sort of genetic disorder. So typically they'll know that baby is going to go to the NICU. Mm-hmm. But then you have babies or moms go into labor early and have mm-hmm. preterm labor, and they weren't expecting to deliver.
Right.
So either way, and even sometimes you'll have kids who you've had a completely normal pregnancy and the birthing process causes some trauma and something happens there, or something that they weren't able to see prenatally is discovered once the baby is born, and then they have to go to the NICU. Yeah. So it really, they say we're about 1% of the population, but that doesn't mean one baby. That just is a small portion of like the babies that are born come to the NICU. And sometimes even NICU nurses might just be at your deliveries, depending mm-hmm. upon if you're a high-risk pregnancy or things like that, just to make sure that the baby's okay. But it doesn't necessarily mean that the baby is going to go to the NICU.
Okay. That's cool.
So,
that's probably
but either way, even if you are prepared for the NICU or you're going, it's still a scary experience.
Definitely. Yeah. And probably still a lot of things that you can't prepare for or wouldn't expect.
Exactly. Yeah. Definitely.
So
go for it.
I wanted to know, what's your day-to-day? Because I think, like, to me, it's like, okay, she's a NICU nurse. Well, what, like, I've never been in there. What's that mm-hmm. like? I cannot imagine.
A lot of people think we're glorified babysitters. That's typically when you think, oh, you're a NICU nurse.
No.
You get to hold babies all day and all this stuff. But
okay, so I'm glad that I asked.
There's actually times where I go months without being able to hold a baby. I mean, that is the best part of my job, is when I get to snuggle them. But, so I work a 12-hour shift, mm-hmm. and you go in, you get report from your off-going nurse. You kind of do like you check your emergency equipment, make sure you have all the things that if something were to go wrong, that you have all the stuff to take care of that baby appropriately in an emergency. We usually only have anywhere from 1 to 3 patients, because it is an ICU.
Okay.
And it kind of just depends upon the acuity of that patient. Mm-hmm. The charge nurses are the ones that kind of take care of that. Mm-hmm. And we try and cluster our cares in the NICU, because when babies sleep is when they do their most growing. Mm-hmm. Fun fact that I learned is that and even us as well, is your growth hormone takes 30 minutes before it starts being secreted. So
once you're
every
asleep.
time, once you're asleep.
Okay.
So every time we wake a baby, it takes another 30 minutes for them, like after they go to sleep, for their growth hormone to be secreted.
Sure.
And that's when they do their most growing,
Right.
is when they're sleeping, as I'm sure with
And that's probably a
Raymond,
huge part
you've known
of
that.
moving their care forward.
Absolutely. And developmentally, making sure that you're doing developmentally appropriate care. So what we do is we kind of cluster our cares based upon if they're eating, if they're not eating, those sorts of things. So usually we try and what we call like touch times about every 3 to 4 hours.
Okay.
But depending upon how sick your baby is, you might be touching them a lot more, or you might be doing some interventions that isn't necessarily touching them, but you're giving medications. You're drawing some labs, you're doing x-rays, rounding with the doctors. You're talking to parents and you're teaching parents different things, telling them what's going on with their baby. You also have typically another patient as well. So you do one, and also you have to document all that stuff.
Right.
And
Lots
kind
of
of keep
notes.
track of, yes, and keep track of everything that you've done for the day, so that you can follow up for, like, if something happens, what changed, looking at their vital signs, that sort of thing. So we're constantly monitoring. I might only be touching them every 3 or 4 hours, but I'm constantly peeking into the isolette. What are they doing? Is their hand on their tube? Are they sleeping? Do they need to be reswaddled? That sort of thing. Documenting, giving medications. We love to get the babies out to hold with parents, and we usually try and coordinate that with care times so that we're not interrupting their sleep.
Sure. Yeah.
And so it kind of is just like a cyclical thing, and
sounds busy.
You do that. Yes, it can be very busy. Then too, if you have a crying baby, or a baby that gets fed, you get to spend a little bit more time with them because you're holding them, soothing them, that sort of thing. But with our more sick babies, we just kind of go in and do our cares, and then we let them be as much as possible and only intervene when necessary. So it can be a pretty busy day. Some days are much busier than others. It just kind of depends on the type of assignment that you get.
Yeah. Right. A pull of the hat.
Yeah, exactly.
Wow. So what, I guess, what's a typical day for a parent in the NICU? Would you be able to?
That is, I would say, dependent upon the parent.
Okay.
Some parents are very involved. They're there all day long. And some parents have other children or have to go back to work or have other circumstances that don't allow them to spend as much time there. So some parents, for example, I would say probably like a pretty involved parent, if they go home at nighttime, which I always encourage parents to go home at nighttime and sleep in their own bed.
Yeah.
And take care of themselves.
Yeah.
Is they'll come in whenever they decide to come in the morning. Usually the nurse that is there will give them an update of what's happened overnight if they haven't called, or just in general give them an update. If it's a breastfeeding mom, she has her own pumping schedule that she stays on. So she's probably kind of has that in her mind for the day. They're allowed to attend rounds with the doctors that kind of go over their plan of care and what changes are going to be made. They can ask questions and kind of get an explanation. If there's been tests that have been going on, then the doctors can explain those things to them. And then kind of
is
they're
that
just
pretty
at the
normal
bedside.
that people are asking questions and?
Oh yeah, absolutely.
Yeah.
And I always highly encourage it.
Sure. Yeah.
I mean, you come in and there's a little lingo in the NICU with different things that we'll say. And parents pick that up, and by the time that they leave, they're fluent in
NICU.
basically. But yes, there's so many things that are so unknown, and a lot of parents want to. Basically, the first question that even a fresh baby that comes in, they're like, "Okay, well, when can they go home?" That's always the first question, because I mean, it's you weren't expecting to be here, or you were expecting to be here, but then what's our trajectory?
Right.
Yeah. So yeah,
setting expectations for themselves, I'm sure.
Exactly. And if you have a preemie, say a baby born at 25 weeks, and they were born, say, in October, but they weren't due until February or something, I usually say expect to be here at least till your due date. give or
Wow.
take. So it's kind of like we're kind of like the gestational period is spent in the NICU. So yeah, parents ask a lot of questions. They kind of, I mean, if they have not been in the medical field and not been exposed to anything, a lot of this stuff is new for them.
Of course, yeah.
And overwhelming. So it definitely takes a lot out of them to like see everything that's going on. And it's important for us as nurses to make sure that we're communicating all the different changes that are going on. Just even to like anticipate what questions they would ask, kind of like I try and just answer everything ahead of time. And then a lot of times, like if I get a phone call from a parent and they want an update, I just go through everything. And then I'm like, okay, well, do you have any questions? And they're like, well, you answered them all. So it's kind of like, if you can like anticipate what they're going to ask and kind of give them all the information forward, I feel like it's a little bit less stressful. Because then they're like, okay, what do I need to ask? Because some parents don't know what to ask, you know? You don't know what you don't know, you know?
No. Yeah. I wouldn't have any idea what to ask.
Yeah.
Same. Starting out. Yeah.
So yes, lots of questions. And then we try and I encourage participation in cares. Reading to your baby, talking to your baby, taking their temperature, changing their diaper. They have a lot of wires, and some babies have minimal wires. Some babies have a lot of wires between IV lines and oximeters and electrodes to monitor like their heart rate and their oxygen levels. So those can be certainly intimidating, but we're right there with you the entire time, walking you through everything. And a lot of times parents that once they're there for like a month, 2 months or more, they're like, oh,
like throwing lines around left and right.
They got it. They know how to put their hands in the portholes and work through that and those sorts of things. So parents do definitely get really comfortable, and they know their baby the best. Sure. We are with them for 12 hours a day. And if you have a consistent baby that you take care of pretty frequently, you kind of know their nuances as well. Right. But parents really do know their babies. They're in there even when we're not in there, if they're at the bedside all day long. So, I encourage participation, and you're your baby's biggest advocate. So ask all the questions. Question what the doctors are doing. Why are you doing that? Trying to understand that. We as nurses try and be the advocates as well, especially if parents are not around. But it's always like if it comes from a parent, sometimes it's taken a little bit differently than when it comes from us.
Sure.
In a good way.
Yeah.
Or
is it pretty...
able to... Oh, go ahead.
No, I was going to say, is that pretty well received on the whole in NICU environments?
I would say so. I think doctors... As long as doctors have an explanation for why they're doing something, parents are a little bit more understanding. I think because they don't know what's going to happen, and they have such a loss of control that being able to like say like, can we do this or can we do that, or like why aren't we doing X, Y, and Z? Makes them feel like they have some sort of control over the situation.
This is making me very emotional.
Yeah,
definitely.
Because this is like, it's different. So like if you were to take your baby into the hospital now that you've known him for a year now, you know him inside and out. These nurses that would meet him don't. So you can tell them, okay, this is what he likes, this is what he doesn't like, this is how I comfort him. But for us, we are your teach. Like we teach you that because you have met this baby for the few minutes when they were born, but then they had to be taken to us.
Right.
So it's a very different experience than getting to have a newborn with you at your bedside after you deliver.
It certainly is.
So yeah.
Yeah, and it must be pretty emotional. I mean, obviously for the parents, but do you find that you get emotional, or you've been doing it for 10 years now and you have better boundaries?
I would definitely say I have decent boundaries. You kind of just see a whole gamut of things, or you expect X, Y, Z to happen with a certain baby because you see it so many different times. But when you take care of patients for days in and days out, and you kind of see like, I can remember my first primary, I knew him when he was like a itty bitty baby.
Yeah.
And then I got to take care of him the night before he got to go home. Like, he had his last eye exam, and they said that, like, his eyes were mature and he got to go home. And I was holding him, holding him in place during this exam, and I started to tear
I
up.
have goosebumps.
Yeah, of course.
Because I think it was like 111 days or something like that he was in the NICU. And just to see, like, how far they come.
Yeah.
And then, like, if you have a baby loss, too, even, that you've taken care of that patient for a long time, it's emotional. But then also too, it's such a reward to see how far they have come as well.
Yeah.
I mean, that primary is now 7 years old and in kindergarten, and that's crazy to me.
You're still connected with a decent number of your patients, aren't you? I feel like I always see pictures of, like, oh, this is Declan, and I've known him for blah 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 years, and
yeah, I love to keep in contact, and you form relationships with the parents. Like, sometimes parents are better. I'm better friends with the parents than some of my other friends, like, I'm still keeping in contact with them more than I am other people.
Sure.
Because parents spend a lot of time at the bedside, you start to get to know each other. And one of my primary's moms and I started watching The Bachelor because she was watching The Bachelor, and then we had something to talk about.
Wow. That's amazing.
So it's just kind of like we kind of become your family, because it's such a
it's an intense experience,
an isolating experience for families, because friends and family that have never had an NICU experience don't really understand what you're going through, and we are there, so we know what you're going through day in and day out. And it's easy to say, Johnny had a great day today, blah 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 blah, but that's good, but they also could tomorrow have a setback, and then you're like, oh, well, now I just shared this good news and we've had a setback. And it's like, it's hard to, probably feel like, have your friends and family support you during that news, because they don't know what you're going through, like what happens inside those four walls of the hospital, inside your NICU room.
Yeah.
What would you say, because people outside don't know, like, if you could tell them now, the people that are listening that might know someone that's a NICU parent, I don't know, how can they support them?
I would say it's kind of more of just doing things for them, or just listening and not always asking a lot of questions. Allow the parents to share with you what they want to. I think some of the information, or like things that are happening within the NICU, can be very overwhelming to share with, like, friends and family. And it gets to be a lot when everyone's texting you, how are you doing today? How's so-and-so doing today? That can be a lot, and they might not answer you. So I think giving them grace in that, giving them space in that, but also saying, hey, can I come sit with you at the bedside for an hour during the day today, just so that you have someone? Because a lot of times the dads have to be at work. Moms are the ones that get the maternity leave or take the leave, but dads have to be at work. So mom's typically at the bedside by herself. So a friend saying, hey, can I bring you lunch, like, and get them away from the bedside for a little bit? Or, like, I'm going to drop some dinners off at your house for you. They'll be in the freezer, because moms do need to eat, especially if they are pumping and breastfeeding. They need to make sure that they're
also just as,
in.
Humans.
As humans, basic human need. But a lot of parents, I feel like, the stress of the NICU, they'll neglect those things. They'll neglect to leave the bedside, and we try as nurses to encourage that, but it's ultimately on them to take care of themselves.
Right.
But just having there's like almost like a no pressure support. So just being there for them, and when they reach out to you, being there
That's
as a
great
listening ear.
Phrase. No pressure support.
No pressure.
That's really good.
So that just so I know that you're there for them, and even just say, like, I don't know what you're going through, but if you want to talk about it, I'm here to listen. And try not to give advice, because they are not.
I think that's a blanket recommendation just for people. Try not to give advice. Try really hard.
Really hard.
I know hard.
It's in our helping nature, because I'm guilty of that as well. Of like, I want to fix your problem, But at the same time, I feel like for the NICU, it's not a normal newborn experience.
Yeah.
So it's not going to be like, oh, well, my baby slept this much, blah, blah, blah. Like your baby should be doing this because when your baby is sick and doesn't feel good, they're not going to be developmentally doing the things that, say, a 2-month-old would do.
Yeah.
And so I think just allowing them just the freedom to speak if they want. I think another big thing is it's called, I want to say it's like the toxic positivity is like the new phrase that everyone puts out there these days.
Yeah.
A lot of people will say, well, at least you have blah, blah, blah. Like at least you have a baby or at least you have this.
That's
like the one thing that I can think of, like at least, you know, like when you talk about like a tough situation, because people might not even know what to say to you. But they don't want to hear that. They don't want to hear at least blah, 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 because they might have had a really crappy day yesterday in the NICU, or they might have had a really crappy day or really crappy start to their NICU stay. And yes, they've made so many progress, but they still don't see that light at the end of the tunnel yet. For leaving the NICU. And then another big thing is if they have other kids, offering to take their kids, cart their kids around, because that can be really stressful, or take their other kids for play dates. Just so that they feel that like their kid's not just with grandma all day, which is great. And I can say from experience, I love my grandma because she took care of me when my brother was in the NICU. But give them like that social interaction that they might have gotten differently if you weren't in the NICU with the other baby all day long.
Yeah.
Because it's important for that child to still get some one-on-one time, especially with you as well, with you as the parent.
Definitely.
Because they're going to remember this experience a lot more than the baby that's in the NICU is going to remember this experience.
Yeah. It's heavily impactful on probably everyone in the family.
Oh, absolutely. Yeah.
So do you want to talk about that a little bit, about your experience as a NICU sibling?
I was thinking that, and I didn't know if I could ask.
Oh, yeah. Yeah. No, it's like everybody knows. It's kind of like one of the things that, well, one of the reasons I became a NICU nurse in the first place, but it's definitely one thing I tell parents too, is as a nurse, I know what it's like to have a sibling in the NICU. So like I encourage them to go home and spend time with their other child and that sort of thing. So I'll kind of give a little background story. My brother was born at 25 weeks. Oh God, 26 years ago, which is crazy because back then technology has come a long way since the time that he was in the NICU. And I was 3.5 at the time. So I don't remember a lot of it. I have bits and pieces that I do remember, but my mom was heavily involved with the March of Dimes, which is an organization that helps research prematurity and just pregnancy in general. So she has shared her story with many chapters and different events that we've done. So I've heard it all. So that's how I know a lot about it, is because I've been told, versus I don't really remember it. I do remember spending a lot of time with like my Aunt Amy, and my grandma, and some of my mom's friends, getting carted around to like preschool and other things like that. And one story that I kind of love to share that I tell other people is that I started to pick up the NICU lingo even as a 3.5-year-old.
Wow, that's amazing.
My mom tells me, so she would go down, the hospital that he was at was about an hour away from where we grew up. So she would go down and
commute.
Yeah. And to do it every day he was in the hospital, I believe, for 115 days.
That's a long time.
He was born in April and came home in August.
Yeah.
So I would go with grandma or whomever during the day. My dad worked. And she would come back up to grandma's typically to pick me up. And when she'd get up there, she would call the NICU and check on him. Yes, she had only been gone an hour. So the nurses were probably like, seriously, you just left.
As a nurse now, you're like, come on, Mom. It's okay.
Yeah, it's fine. They're okay. We'll call you if something changes. But we also, it's good. Like, it's good to be an involved parent. So there's nothing
absolutely. Yeah.
So she would call and check in on him when she would come, like, to pick me up or whatever. And I guess there was one time that she got off the phone and I was like, is he still on CPAP? And that's a respiratory support that babies get put on. And so like at 3.5, I'm figuring out what NICU lingo is going on and what he's doing and that sort of thing.
And probably wanting to be involved and wanting to take part in the really important conversation that's going on all the time around you.
Exactly. Yeah. So it's definitely been a big impact on my life. Obviously has made the decision for me to become a NICU nurse, and I think helps kind of not give me a leverage, but kind of give me some insight into what these parents' lives are like, as well as what the sibling's child is like. Yeah. And now I'm the nurse, so what a nurse's perspective is as well.
Definitely.
And we even still keep in contact with at least one or two of JC's primary nurses after 26 years. So even that's why I think one of the things that I love the most about the NICU is the relationships that you form and getting to watch these babies grow. So that years and years from now, even when I have my own babies and whatnot, that like you have some from many, many years ago and you get to watch them grow and see what they accomplish in life. Because some of these NICU babies that are preemies can have devastating developmental effects, or they can be like completely normal. We'll put quotations because there's always who's normal. Yep. But you can see like what they can accomplish and what you could expect from, say, a 25-weeker is different for every baby. So it's always it's great to see like how far they come and what they accomplish.
Yeah, I'm sure it gives you a really awesome perspective on what you're doing for those teeny tiny humans on a daily basis.
Yeah, definitely. Yeah.
Speaking of which, we should show people your shirt.
Show my shirt. It says it's a beautiful day to save tiny humans.
I love it. I love it. Oh, well, this is awesome.
Yes.
You have worked in a lot of different hospitals.
Yeah.
Can you tell us, like, what's the same everywhere you go? What is, like, really variable from hospital to hospital? What have you seen in that gamut of experiences?
Taking care of a baby is the same not nationwide, but nationwide. Like, the things that you do, like your assessment and that sort of thing. Some doctors have different ideas of doing things. And one thing that I've definitely learned is that there's not specifically one right way to do it. There's one way that may seem easier or that makes more sense or that seems to get the job done a little bit better, but there's multiple ways to do the same thing. And as long as you get to the same outcome, it's okay how you get there. You know, it's kind of
Can
like
you give an example of that?
Let me think. Oh gosh. I feel like there's
just put her on the spot there.
Yes. Put on the spot. You know, I wrote notes. I did not.
I know. I'm so sorry. You looked like you were thinking about something specific. That's why I asked.
I'm trying to think. Well, because I feel like, and that's the thing is sometimes like hospital to hospital, the same thing could be different. Okay. This is an easy one. That's what I can get.
Great. Whew.
It's kind of weird. It's not like NICU specific. It's just like in general is taping an IV.
Okay.
So one hospital might tape it one way, another hospital might tape it another way, and sometimes it also depends upon what. So the IV like catheters are all the same, but sometimes the equipment that attaches it, depending upon what the hospital buys, is different. So that can be taped differently, or whatever like tapes and stuff that the hospital has might be different. So I'm going to throw out some words. You might not know what I mean, but I can clarify. Okay. So you've got your catheter, and you could either have just a plain clear tegaderm that you put over the catheter with some other like skinny tape, or there's like a teddy bear tegaderm that has clear, and then it has like little things that go like around the catheter to hold it a little bit stabler, in my opinion. And then like you could use cotton balls and arm boards and different things like that. So, and even nurse to nurse, some people prefer to like tape differently. So that I would say is like something that you have to learn, like what equipment they have that's different. Sometimes even just like the pumps for like IV medications are different from place to
wow.
place. So like learning those. One thing I've definitely found interesting is how much like hospitals, especially I feel like NICUs or children's hospitals, benefit from like donations and things like that, with like developmental care products,
Oh.
to help like position babies.
What sort of
Some
things are those?
So there's like we call it Freddy the Frog. It's like a little bean bag. So one of the things you want to do for like developmental care, especially for a preemie, is you want to kind of simulate what it would still be like if they were in utero. So they have boundaries, and you want to keep them like a little cocoon.
Okay.
So you kind of want to support their head and their butt and their legs, and kind of keep them all like in that tight position, like they would be
The
if they were
fetal
inside
position.
of you. The fetal position, yeah, exactly. So there's a variety of developmental positioners that you can buy and use to help promote that. And I have found that's one thing that, depending upon the type of, like, depending upon the hospital, some have more of than others. You can makeshift things with blankets and towels and things like that. But these, I feel like are just like specifically made. And you just have to be also careful of like fabrics and stuff as well. Because their skin, the baby's skin is so sensitive, especially your preemies, that you want to be careful what's touching them.
Sure.
Right. Wow.
I feel like those are like two easy ones. I'm sure there's more
Yeah.
that are
No,
different.
thank you.
But
I appreciate the specifics. That's helpful.
Yeah, that was cool.
no. And sometimes too, like doctors, like, because I worked in Rochester, New York for the first 3 years. So that's like where my basis of knowledge is. And I feel like they really prepared me. I started traveling after 3 years. And so I kind of like questioned some doctors, like, why aren't we doing this or doing that at another hospital? And so the way that we did it in Rochester might be different than the way that another doctor learned from their fellowship and whatnot. So they like it this way instead. So it's still getting us to the same outcome, but we might just be doing it for a different reason, or have a different reason of why we won't do something versus why we would do something.
Yeah. Was it kind of a learning curve to be like, oh, this is also okay?
Yes. Yeah. Especially because most NICU nurses are type A, and we want things done the way we want them done.
The right way, the correct
The right way. Yeah,
Exactly.
exactly. So we'll just do it our right way the first time. That's one of the things too, is as a traveling nurse, and I feel like as a NICU nurse too, but we are so like type A in like we like things done the right way. We like our bedsides like clean and nice and tidy, and all our wires looking good and all this stuff. Excuse me. But when you go as a traveler, you kind of have to be like flexible and go with the flow. So it's like I'm like this one extreme to the next. Like I'm very like go with the flow, whatever, nothing phases me. But then I'm like I still want it this way.
But actually, though.
Yeah.
No, I think that's probably a great experience for someone with that kind of type A personality to have, because it forces you to be a little more flexible.
Yeah.
And then you can
and I think that
find the balance there.
In your rest of your life too, like outside of
sure.
life.
Yeah.
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 But yeah.
Awesome.
Yeah. It's really cool to be able to see a bunch of different hospitals in different areas. So when I worked in Boston, I had a lot more preemies. Then when I worked in California, I had a lot more cardiac or genetic babies, or GI babies. So it's kind of like sometimes depending upon the area, like the geographical area, there's some things that you might see more of. But then also sometimes hospitals specialize.
Yeah, I was going to say, is that a function of what babies were being born, or a function of the hospital and
I think it's a combination
why people
of the
end
two.
up there? Okay.
Yeah, I think it's a combination of the two. And if there's like a specific cardiac doctors that everyone wants to see, or prenatally that's who you saw, then you'll deliver there because that's where your surgery will likely get done.
That makes sense.
And then some hospitals, so like a freestanding children's hospital, you'll get a lot of your like genetics and cardiac GI, those sorts of things. But then there's some hospitals, like delivering hospitals, that what we call like a level 3. So any surgeries are usually sent to a children's hospital, and it's mostly just like preemies that need to be in the hospital for an extended period of time.
Okay.
So there's different types of NICUs, and what they can do, what they can't do. So sometimes even when you're at one NICU, you might have to be transferred to another one depending upon what your baby's needs are.
Oh, well, that's good to know.
So, yeah.
Because I've heard of NICUs. I haven't heard of the subset of the kinds of NICUs that there are, right?
Level 4 is your highest,
Okay.
which is kind of the opposite of like trauma level. So like when you hear like a trauma level 1 hospital, that's like the best trauma hospital. But for us, the higher number is the better NICU.
Okay.
So
or the more
typically,
specialized, is it like better across the board, or is it more specialized for specific things?
It's more specialized for more specific things. Like we can do up to like, we do surgeries and we can do ECMO. So ECMO is where they have like a catheter in their neck that does bypass.
Oh,
and
wow.
so babies like if you were to have heart surgery right now and needed to have open heart surgery and they'd put you on bypass, so basically it does what your lungs would do. That's what we do for some babies.
Wow.
So we can do up to that.
Technology is amazing.
A level 3 NICU really only takes care of like the babies before they would like as high as like an oscillator or a jet, which is a high frequency. And I know that makes no sense to you what that means.
But it sounds really
it's a type
cool.
of ventilator. It's the highest ventilator you could go on.
Okay.
So that's like that's typically the most difference between level 3 and level 4. And then level 4 does surgeries as well.
Wow.
Yeah. So there's more to it than just like my baby's in the NICU.
Right. Yeah, which takes it back to like it's such an isolating experience or an individual experience.
Yeah. And that's one thing too is you might have 2 24-weekers and both of them could be very different in like what their outcomes are. So, and that's the thing too, is even if a mom had 2 preemies, like had a preemie and then had another baby, like their journeys could still be totally different.
Right.
Yeah.
So you can't compare. That's another thing too, is you don't want to compare like, oh, well, this mom is having this experience in the NICU and whatnot. I definitely think it's nice. And I think parents, develop good relationships with other NICU parents because they're kind of going through the same thing, at least being in those same walls and understanding the hardships, because like I said, it's sometimes the outside people don't understand completely what's going on. But you can't compare to what their baby's doing because their baby might have another whole slew of things that you don't know about.
Sure.
That they haven't shared with you. So that's one thing, is definitely keep it separate. Like, don't compare, because you'll kind of get disappointed, I would say, if you do.
Yeah, there's a really good phrase, don't compare your insides to someone else's outsides.
Right. Yeah, I like that.
Because what they're experiencing may be different from what they're talking about.
Exactly. Oh, yeah. I totally agree with that.
Yeah.
Yeah, that's good.
Yeah, it's really good.
That's really good.
It's a good one. I think it's an Al-Anon thing, but I'm not sure. I've heard it a few times recently.
Yeah.
Awesome. Well, cool. Is there anything else we want to talk about, Hannah?
Yeah, I have one more question, and I think we touched on some of this, but I just want to go at it again.
Yeah.
Because we said that in some cases, parents know before they give birth that the baby is going to be in the NICU, and that probably already brings up a whole lot of stuff. What can be done? How is there any way they can prepare themselves? 'Cause, like when you just talked about connecting to people, I thought, oh, well, maybe that's something I could do beforehand. Find other people. And I don't know, maybe already if I have siblings, figure that out. Who's going to take care? I don't know. How could people possibly, parents,
prepare themselves? I definitely think there's definitely so many Facebook groups or Instagram people that have started to share their journeys with their NICU babies, whether it be a genetic disorder or a trach or G-tube or whatever it may be. So I definitely think like finding those groups and connecting with other moms, because it will also, I feel like when you do start that journey, it will make you feel seen, you know, because they've gone through that same thing before, that you're not feeling crazy. So yeah, I would say connection for sure with other people. I would definitely say just know, I feel like you can prepare yourself only so much, because I think there are a lot of hospitals too that will allow you to do tours if you know that you're going to be in the NICU. So take advantage of that and get a tour of the NICU that you're going to be in, so that you kind of know what you're going to look like. It can be very overwhelming. There's monitors, there's noises, there's things like that. There's wires and cords and things you've never seen, and you're going to see your baby going through all of this. So I think getting to see that beforehand. Also, I think if you have another child, like potentially prepping your child for that. Like, mom is going to be gone during the day, but we're going to have like this special time on X day or whatever. Like, I know there's a lot of parents that they won't come in on the weekends. Like, they'll come in Monday through Friday, but then they'll spend their weekends with their kids. And especially sometimes parents are not close by. They have to travel to come to the NICU. So sometimes they stay bedside for the week and then go home on the weekends. And so I think making sure that you kind of just have some preparations for that. Yeah, like have what your child will be doing during that time, and prep them and just let them know, like, mom's still here, like, I'm not leaving, but I'm not going to be around as much, and you're going to be with grandma, or you're going to be with Aunt Karen, or you're going to be with whomever, you know, on these days, just so that they know that you haven't left and aren't coming back, because that can be traumatizing.
Yeah. Would you advise taking the siblings to the NICU once in a while?
Absolutely. Yeah. Oh, absolutely. I used to go as a kid, when my brother was in the NICU. I think that makes them feel connected, and that makes them feel like they are a part of it. Yeah. Right now, involved. Unfortunately, with COVID, we don't allow kids in the NICU, and we don't allow usually during cold and flu season. So usually like November to March-ish, siblings are not allowed. There is obviously the exceptions if you have a child death or those sorts of things, that they can make the exception, but usually baby, or like the siblings are allowed. You just have to have like vaccination records or something like that, that you have to show. But yes, I definitely encourage that, because then they know the baby. They get to, I think, participate and get to see the baby and read to the baby and those sorts of things that make them feel like they're a part of this journey as well. And it may even affect them like it did me, and they'll become a nurse in the NICU or something.
Maybe they'll become a fantastic NICU nurse.
So yes, definitely involving your other child. Other preparation, I feel like it's kind of just based on what kind of person you are. Do you like to have a lot of information, or do you not like to have a lot of information? Would you rather not know what's going to happen and just like see what happens, or would you rather have done all the research? And the thing is too, is you might do all the research and prepare yourself, and then something different might happen. So it's hard, you know? It's hard to be fully prepared, because the NICU, it changes on a day-to-day basis. It seems like, even hour to hour, minute to minute, even. It's definitely a interesting place for sure.
It's so interesting, because I keep thinking about this in the context of a quote unquote normal postpartum, or specifically my experience of postpartum. Because it is also isolating to a certain degree, and it still changes minute to minute, and it's but there's obviously a lot less risk, and there's a lot, the intensity, I feel like, in the situations that you're encountering is just so high, and it's already such an intense time.
Yeah. The one thing that I say is you don't want a NICU experience, but the one I would say positive is that you as the mom get to go home and take care of just yourself. You don't have to take care of your baby as well. And so take that time to recover and take care of yourself, because then when your baby comes home, you will be like ready to take care of that baby.
Yeah. It also is probably so necessary. I mean, I remember being like, I don't even have time to do my sitz bath, and
Yeah.
I'm supposed to be sleeping, and I can't.
Yes, exactly.
So I'm sure that in such an intense experience, having the opportunity to take care of yourself may even help you just maintain surviving.
Yeah, absolutely. Yeah. Well, and that's what I also say, like, go home at night. Go home and sleep in your own bed.
Yeah.
Like, it can be exhausting
Yeah.
to be at the bedside all day long and not get outside and that sort of thing. Like, even leave just to go get dinner. You know, like, take care of yourself. Like,
I think
that's
it might
really
take me
important.
a few days to take that advice.
Oh, yes.
Like, I see the value of that advice, and I see the, like, logic of that reasoning, but I think it would probably take me a few days until I hit the wall of exhaustion to take that advice.
That you were like, okay, fine, I'll go.
Yeah.
Yeah.
Okay.
Yeah.
Are there times, like, do parents get kicked out, or like if they want to spend the night, okay, fine?
No, we have accommodations. So, like, we encourage them to go home, but if they want to stay, they are more than welcome to stay. I mean, we have had social situations that we've had to, like, kick parents out for bad behavior and things like that. But no, we can't, like, kick you out unless, like, we might ask you to step out if we're doing, like, a sterile procedure or something, like doing an x-ray or something like that, which we have every right to do that. But we can't necessarily tell you to go home. You're allowed at the NICU 24/7.
Okay.
So it's your choice.
What?
But after a number of days, you're going to go a little crazy. So
Yeah.
For sure. What for parents that want to, like, support their NICU team as much as possible, what can they do in that aspect of it?
Oh, I like that question.
as in, like, for us?
For you to, you know, facilitate your caring for their baby, like, what do you look for in a parent? What's your ideal parent doing or not doing that makes your job and caring for that baby
easier? Oh gosh, I feel like there's probably things I can't say, but
we don't want you to get in trouble. We can cut anything you regret.
No, you're good. I would definitely say we like involved parents, but there is, I feel like, that level of, like, over involvement, like overstepping, doing things. Like I said, we like to cluster our cares. And sometimes parents just want to poke and prod at their child, and you just want to say, like, get your hands off them. But it's hard to do that as well because it's their baby, you know?
Yeah, of
and
course.
we always, like I said, we try and educate developmentally appropriate care, but they don't always listen, which is fine. So I would say, like, an involved parent. I would say someone who, God, it's hard. I mean, it's such an anxiety provoking experience. So I can't, I can't hold some people accountable for what they're feeling.
Yeah.
But the thing is also, too, as a parent, you have to understand that, like, we're doing the best that we can. And there's some things that are out of our control that is just happening with your baby, or we're doing what the doctor has asked us to do. And yes, this fourth poke on your child might not be what you want us to be doing, but they need an IV, so we have to do it. So, like, kind of, like, also giving us grace, because we want to take the best care of your baby. But we also need you to, like, partner with us to do that, and not necessarily be yelling at us or being down our throats about certain things, because some of the things are not in our control.
Right.
And that we're humans too, and sometimes we have a bad day.
Right.
And yes, we try and not bring it to work, but it doesn't mean that it doesn't affect us during our day-to-day life.
I think grace is a great word. I think grace, and I think what you're describing sounds like the expectation that what you're doing is motivated in a
positive way.
Right.
Yeah. And follow the rules. When we tell you to leave your mask on, leave your mask on. When you can't have food in the room, don't have food in the room. Because that's another thing is too, is like some people will enforce them and some people won't. And then parents get mad when they do get enforced. And so it's frustrating. Like, and yes, that's kind of on us as nurses too, like the consistency, but it's like, we already told you the rules. Just follow them. Like, you are not a teenager or a 5-year-old child. You are an adult with a baby.
Right. And again, those rules are in place to take better care for your baby.
Right. Exactly.
And for the other people's babies that are in that ward.
Exactly. Yeah, absolutely. We're just trying to keep everyone safe, and we're trying to get your baby home to you. I know we don't want you here just as much as you don't want to be here. Not in a bad way.
Right.
We don't want to have you in the NICU. Yeah. It's like a secret club you don't want to have to know about. Yeah. But it's a family when you do know about it.
Right. Yeah. What is the part you love the most about your job?
I think getting to develop the relationships with the families and the babies.
That's awesome.
And getting to see like how far they come. Yeah. Which is really awesome. And like I said, I have one that's 7 years old and in kindergarten. I still will randomly touch base with them and check in, and it's really great for them to like send you updates and pictures and things like that. And I mean, Facebook is great and whatnot, so you can sometimes see that. But I think the relationships that you create with them is really nice. And especially for me as someone who I've worked in so many NICUs, so a lot of times I'm new to the city or the state that I'm visiting. So even for parents to share with me different things that I should be doing, it kind of just feels a little bit more welcoming for me as well. Yeah, as them,
And you're giving them an opportunity to be an expert in something when they're feeling their most vulnerable and
powerful
and ignorant.
Yeah. That's also too one of my favorite things is getting to teach, like educate parents. Like one of the most satisfying feelings is like when you give a parent an update and then the doctor comes in and gives the parent an update and they're like, oh yeah, she just told me that. Yeah. Or they can reiterate back to you why you're doing something, or reiterate to a doctor like, okay, she said we're doing this. Like, why are we doing this? Yeah. Like for them to like basically teach back to you what you taught them. It's very satisfying.
Wow. I believe it.
It's like, yes, really, they caught it. They learned it. Like they know.
They're understanding what we're
doing.
And
that empowers them.
Absolutely.
Having the knowledge. Knowledge is power for sure.
Oh, Emily, you are so cool.
Yeah.
It's so wonderful awesome to hear you talk about this.
Thanks. I love it. I don't see myself doing anything else.
Well, it sounds like you're great at it. So carry on.
Thanks.
Thank you for being here. Is there anything you want to share before we go?
I'm trying to think. I just want to look over my notes real quick. Let's see. It's a marathon, not a sprint. You're going to have 1 step forward, 2 steps back. That's normal. It's okay. You will get to the end. And for me personally, I like to try and create as many normal things as possible for moms or parents. So like I also encourage them to do that as well. Like, let's take monthly pictures, or let's commemorate their first bath, or things like that. Like if you bought the 1 month, 2 month, 3 month stickers, like let's celebrate that, like let's try and create some sort of normalcy. Hold your baby as frequently as they're allowed to be, especially when they get less sick. They can be held kind of at any time. Read to your baby, talk to your baby. It's definitely, even research shows that the more that you talk and read to your baby, even if they are a preemie, the better. And being at the bedside and being involved in your infant's care, they have better outcomes that way.
Yeah.
Bring in own clothing and blankets. Because then that's also like you get to have some of what you had gotten for them, and kind of just like personalizes their room. You can bring in pictures of like the other kids, or if your other child makes any drawings for them or things like that, like you can kind of decorate the room. One of my primaries, we did like a theme. We did Piglet, and so like that's kind of like her little like character now is Piglet, like, and we call her that. Cute. So like just kind of create those things that are like personal to that baby so that it kind of feels as normal of an experience for you as possible.
Right.
And we know that you don't have any control. Like we take a lot of your control away. So when we give it to you, change their diaper, take their temperature, bring their clothes in, get them dressed, pick out their outfit, like take what you can, because unfortunately we can't give you all the control, but try and take what you can, because we know that it's hard.
Yeah, I think it's easy to imagine that experience as being before normal life starts.
Yeah.
Before your life with that child starts. And
yeah,
if it's 100 days or more, like that's time. That's
a lot
the
of
start
time.
of that baby's life and the continuation of your life and your life with them. I think that's really
Absolutely.
important to remember.
Yeah. And if you have, like parents can have PTSD and emotional things afterwards,
No
that
doubt.
was quite a trying time. And so seek out help from other people, have resources, those sorts of things. Like, I think that's important for continuing, especially if your baby continues on like a medically fragile journey after they leave the NICU, that you have that support and that sort of thing.
Are there
Because it will
generally
benefit
support
you.
groups in hospitals
Oh, so yeah, that's
or otherwise?
there's a lot of times mom group, like NICU mom groups,
Okay.
or things like that, like support groups. And a lot of times too, if your baby, say, is getting a trach or a G tube, they might reach out to our social workers or case managers might reach out to another fellow family that has been put on the list of like they're happy to be contacted, so that they can connect you, so that you can ask questions. Just so that you feel supported and they're like, oh, okay, you went through the same thing. Just like I said, so you can feel seen and like you're not the only one that has ever had to go through this before. And there, like one thing, like I just mentioning social workers and case managers, there's a lot of people that you will meet in the NICU. You have developmental specialists, you have OT, PT, speech, your nurses, your NPs, your doctors, your tech, like all these different techs. So there's a lot of people that you're going to meet. It can be very overwhelming in the beginning, but know that we are there to guide you and educate you, and we will basically prepare you to be able to take your child home. Like sometimes, like even I'm just like, I'm sure with your experience, Megan, like you took a baby home and you're like, I have no idea what to do. But you kind of have like a luxury of like education class for however long you're in the NICU, because we will educate you on everything, like how to feed a baby, how to do this, how to do that, so that you're like 100% prepared when you go home.
Yeah, that's really excellent, especially with an added level of risk or uncertainty.
Yeah, exactly.
That's awesome.
I think that's
Thank
all.
you so much for your time.
You're welcome. Anytime. I could talk and talk and talk. You could ask more questions.
How good.
Well, you can come back sometime if you want.
All right.
So, for you listening, if you have any questions, leave them in the comments on Instagram, on the post from today, on the YouTube, and then we can have Emily back and ask her your questions.
Sounds great.
Cool. Well, I think that's it.
Yeah.
Thank you.
Thank you.
Thank you so much.
And Hannah and I will talk to you next week.
Sounds
Bye.
great.
Thanks, everyone. Bye.